woman struggling for many, many years um, with obesity, depression, driving through fast food restaurants every night, multiple trials of dieting and exercise and meds. And during the discussion, the residents who had no attending psychiatrist who could help them got all their information from the books. And I'm going to talk more about this at the conference, but they got their information on what to do, what therapies, and what medications from this medical manual called Up to Date. You pay hundreds of dollars a year and they change it, and Up to Date gives you this information of how to treat a patient. And you put in binge eating disorder, and the information that these young psychiatrists got on the treatment of binge eating had no bearing on reality, on the treatment approaches that I've been utilizing for 20 plus years, seeing thousands of patients. And it was just striking to me and certainly eye-opening that our trainees in psychiatry do not get any training in eating disorders, maybe 2 or 3 hours. In New England, I give 2-hour talks to most of the psychiatric residents, Harvard, Tufts, Dartmouth, and that's it. And then for nutrition information is completely lacking in our training as physicians. So this angered me that they were so wrong, and Up to Date was so wrong from the clinical reality. I, put together the conference next weekend and would like to kind of share a little bit with you. And I guess I'm going to pick on the field of psychiatry a bit to put things in perspective. And our medical model for any diagnosis, whether it's an ear infection or a headache, our colleagues in medicine, they measure symptoms, right? They might, let's take the headache. They may do an eye exam, an ear exam. They might do a CAT scan, blood test. And then whatever they find, they're going to do what I call anti-physiology treatment. If you have a muscle tension headache and there are no other findings, then maybe Motrin and relaxation exercise versus a brain tumor versus a migraine versus any other cause of a headache. So the treatment is going to be based on what they're finding. And then they're going to retest and make sure we know what was happening. But and these are all the possibility blood tests that are medical model. But what's our model in psychiatry? What do we do? Right? We ask a lot of questions. And based on these questions, we come up with this name. And our entire field of psychiatry is based on this symptomatic-based approach, right? And if you are sad and depressed, we're going to call it depression. We have no concept of whether it's due to low thyroid, low B12, trauma, loss, digestive issue, a nutrient mineral deficiency. It doesn't matter. All we know is you're depressed. We look in our crystal ball and say, okay, we're going to give you an antidepressant. And then we're going to ask how you're doing. Right? There's no concept in psychiatry for understanding etiology or root cause.